The first author of this video is a founder and shareholder of APX Ophthalmology. Small pupil is a major challenge in intraocular surgery, mainly cataract surgery, and may lead to severe complications. There are several strategies to dilate the constricted pupil, including mechanical stretching of the pupil, multiple sphincterotomies, utilizing iris hooks, or using intraocular pupillary rings, the Malugin ring being currently the most popular option. However, some of these procedures are cumbersome and time-consuming, and often require excessive intraocular manipulations during insertion and removal. The Osseo-Pupil Expander, or APX, is a novel device for pupil dilation, based on a concept different than any other device in the market. The principle is what one would intuitively do in order to open up and widen a circular rubber band using his own fingers. Pupil expansion is achieved by using two devices inserted through two 19-gauge side port incisions, typically placed one opposite to the other. The APX is inserted with its two arms firmly closed using designated forceps. The tips of the devices are positioned behind the iris so that the pupillary margin is located between the two pins. The distal hook is located behind the iris, where the proximal pin is positioned in front of the iris to prevent its slippage along the arms of the device. Once the two arms of the APX are in the correct position, the forceps are gently released to allow a smooth and controlled opening of the APX to its full length. The pupil will then be dilated to create a 6 by 6 mm quadrangle opening. All surgical maneuvers can then be performed using routine techniques under direct visualizations. At the end of the procedure, the devices are removed using the same designated forceps. The arms of the APX are firmly closed and the device is simply pulled out in a matter of a few seconds. The location of the side port incisions determines the shape of the pupillary opening. Asymmetrical, non-opposite location of the incisions results in a trapezoidal opening with its wider base facing the surgeon. This provides a wide, device-free area in which the arms of the pupil expander do not impede with the access of surgical instruments. The side port incisions are done parallel to the iris plan. The tips of the APX are bent backward to position the terminal hooks behind the iris, whereas the rest of the expander lies parallel to the iris. The arms of the APX are only partially opened to approximately the diameter of the constricted pupil. The terminal tips are positioned properly behind the iris, and only then the device is released to its full extension. In case an arm is not positioned properly, it can be repositioned by maneuvering the external part of the same arm. Note that there is no need to perform any intraocular manipulation during insertion, reposition, or removal of the APX. The stainless steel APX 100 was used in a variety of cases, including pseudoexfoliation syndrome, uveitic cataract, post-glaucoma filtration surgery, mature and hypermature dense nuclear cataract, patients with clinical IFEs, secondary implantation of PCIOLs in aphakic eyes, and operations combined with pars plana vitrectomy. In the following case, surgery included pars plana vitrectomy for removal of dislocated crystalline lens. Posterior chamber IOL was secured to the scleral wall by the so-called glue fixation. The APX devices did not interfere with positioning or utilization of the posterior segment surgical instruments or the creation of scleral flaps for the IOL fixation. In all cases, the operations were successfully performed with effective pupil dilation throughout surgery. Surgeries were done in superior, lateral, or oblique approaches according to surgeon's preference. No intraoperative or postoperative devices-related complications were noted. The plastic disposable version APX 200 is now at its final production and regulatory stages. Experimental studies on porcine eyes confirm the feasibility and comfortable use of the disposable devices. To summarize, the APX pupil dilator provides an effective solution to one of the most significant challenges in intraocular surgery, namely the small pupil. Clinical experience in a variety of complex cases has demonstrated its high safety profile and surgical efficiency.